Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back, everyone, to yet another episode of You and Your Doctor, sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3. You're also able to watch us on AMP2.tv. I'm your host, Raymond Phillips, and today we have three very special guests with us today. Dr. David Selzer, who is an internal medical specialist with NYU Langone Medical Associates, and he is here with two other associates from his practice today. They are located in Delray Beach, Florida, as well as West Palm Beach, Florida. Before we start our show today, we're going to take a quick commercial break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. Again, I am your host, Raymond Phillips, and today we are with Dr. Selzer, Miss Meckler, and Miss Lifschitz. How are you guys doing today?
Doing great.
Doing great.
Wow.
You know, it is definitely such an honor to have all three of you on the show tonight. This is the first time we have three guests. How are you feeling?
A little nervous.
A little nervous,
Excited.
That's okay. We can get out the nervous jiggles now, shake your hands. So as we're starting off the show today, let's just go around, and I would love to hear your medical backgrounds and how you got associated with Dr. Selzer.
So I am a registered dietitian, and I started off working in the hospital, but I saw a lot of sick patients, and it was already too late to intervene. So I wanted to go into preventative nutrition. I met Dr. Selzer in the community I was living in at the time, and he said, I want to do weight loss therapy, and I really want to have a dietitian involved. And so he brought me into NYU.
Wow, that's amazing. How about you?
So I'm a clinical social worker, and I got into social work because I really wanted to help people. My background is I was a social worker in the South Bronx, and I worked at a nonprofit. And I know Dr. Selzer also through my community here in Boca. And he wanted to add a social worker to do emotional therapy to our patients. So I came aboard, and I'm really proud to be an employee of NYU.
That's truly amazing. And Dr. Selzer, tell us a little bit about your medical background.
So I was hired out of fellowship 5 years ago to work for NYU Langone, and we just started 2 new medical practices, one in Delray and one in West Palm Beach. As the years went on, especially right around COVID time, we saw that patients were gaining an enormous amount of weight due to anxiety and due to the frustration of the pandemic. And we wanted to do something about it in order to help our patients because we found that, especially with COVID-19, the higher the BMI, the weight of the patient, the more likely they were going to have a higher risk of morbidity and mortality. So I joined the Obesity Medicine Association, and they learned all about it and what their goals are and what their game plans were. So their main approach is that you need 4 tenets in order to achieve sustainable weight loss. Number 1, medical therapy. Number 2 was nutrition counseling. Number 3 was to have emotional therapy. And number 4 was to improve exercise capacity. So we set us about in order to make this all happen. So we hired slowly, and we employed a nutritionist, a social worker, and a physical therapist who I would have loved to bring in tonight, but she had some personal issues, so she couldn't come this evening and join us. And that's sort of our approach. We try to do evidence-based in order to help people achieve sustainable weight loss and to help on the preventative side of medical care. As a physician, when you start seeing all these comorbidities happen and you can prevent it, and ever so slightly, you can get that patient into a net negative caloric balance by helping them achieve that. And you could prevent them from getting that heart attack, that diabetes, that kidney disease that will cause significant worsening of their overall health. Doing that when they're in their 40s, 50s, 60s, so they don't have a problem in their 70s and 80s and make their life just so much better later on, that gives us an enormous amount of joy.
Absolutely, especially with and I like to use the word epidemic, the obesity epidemic that is really just plaguing this nation. We're seeing kids younger and younger develop signs of obesity, and it's absolutely astonishing to me how we've kind of declined as a society to see people like you guys, making an effort to combat obesity within our Boca Raton community or South community as a whole is just truly amazing for sure. So tell me a little bit more about your practice and how you're able to incorporate these ideologies into your day-to-day practices and day-to-day work.
So to start off, I'm an internal medicine physician who has done a fellowship in kidney disease. So my first approach is a holistic approach of how do I take care of the patient overall. If they have an acute issue, that's going to have to come first. If they have a pneumonia, they have shortness of breath, chest pain, whatever it is, we have to make sure that that is cared for, number 1. And we have to take a holistic approach to their overall wellness. We pride ourselves in taking care of the patient first and with the goal of weight loss in order to help prevent problems going forward. So our first step typically is introduce ourselves, tell them about the different therapies that are offered, get basic blood panels, EKG, possibly an echo in order to evaluate their entire metabolic status, their cardiovascular status, their breathing ability before they start on any medications. So typically, once we do that, then we can decide on different medication options that are available to the patient based on what would be good for them, what is affordable, because a lot of these medications, some are and some are not covered by their insurance plan. And we try to work with them to try to find that right balance between what is best for them chemically and metabolically, what is affordable to them, and we go from there. Typically, we start off with what we call the GLP medications. I'm sure people have read about the Ozempics and Trulicity of the world. Also tirzepatide, which is the newest medication on the market, which helps people lose weight. Other options that we can consider are medications that stimulate the heart, which we try to avoid because that can cause some cardiovascular damage. Other medications that are there are medications for binge eating disorder, people who have difficulty with their ability to control their emotions, and sometimes they take it out on overeating. So there's medications we can give for that. There's people who refuse to quit smoking because they're afraid that they're going to overeat afterwards. So we try to find that balance between that. Now, all the medications, we're a big believer in explaining that this is an adjunct. This is to help you. This isn't going to cure you. These are not miracle drugs. And we sort of stress that. We don't guarantee that, oh, you take this med, you're going to be perfect right afterwards. No, we believe in it takes work, it takes diligence in order to change your ways. Which is why we don't just say, here's a pill and go home. We say, here's some medication, but I'm also going to have you work with all of our therapists in order to create a more global approach to the medical care of the patient.
Absolutely. And I tell, I'm a personal trainer as well during the day. And I always tell my clients that when it comes to your health and well-being, there's no one specific area that is a fix for all. You can't just take these medications and expect all your problems to be solved. So the fact that you have people who deal with the, the nutritional side of it, the physical side of it, as well as the emotional side of it, you really encompass all areas of health and wellness when helping your patients, and that's truly amazing. So Ms. Meckler, as a nutritionist, what are some things that you do for your patients to really help them get them back on track in their lives?
So the first thing that I do is I look at their medical history, and I'm not just looking at them as, okay, you need to lose X amount of weight. I'm looking to see, do they have kidney disease? Do they have diabetes? Do they have high cholesterol? And so I always tackle that first, doing some medical nutrition therapy, along with making changes to decrease their caloric intake, making sure that their food intake goes along with whatever medication they're being prescribed. From the personal trainer aspect, I do also recommend, a certain amount of physical activity within their limits, because everybody comes in all different shapes and sizes and abilities. And I really take into account their personal life as well, because people have different cooking abilities. People have different social habits. Living down here in Florida, going out to eat is a big part of people's lives. So I really work with them to personalize their nutrition therapy. And then I tell them I am your accountability coach. So you come back to me, you tell me what doesn't work. I work with you. We reevaluate their goals from session to session. And people seem to like to talk to me. So I get a lot of their personal their information, and it just helps me really tackle their nutrition on a deeper level.
That's, again, I know I'm saying this a lot, but it really is truly amazing, because when it comes to nutrition, I'm a firm believer that if you don't know, you don't know. And so it can be very difficult to start to make the progress that you want to make. But if your nutrition is not there, that's such a vital aspect of health and wellness. So again, even more amazing that you're able to bring this all into your practice. And Ms. Lifschitz, as a social worker, how are you able to bring in the emotional aspect and really help your patients on a deeper level?
I think for me, it's really understanding the barriers that prevent our patients from moving forward with their goals in life, with weight loss, understanding family history, understanding maybe some of our patients have had past traumatic experiences, identifying, talking about it. And for me, it's really, let's talk about coping skills. When you are feeling really depressed, how can we cope with that depression? What steps need to be taken? My approach is come as you are, come as you will, and let's talk about it. Let's understand why we're in this point in our life, and it's okay. We've all been there. We've all struggled. The struggle is real, and let's move forward. Let's move forward in order to meet our goals and be productive and be happy
Absolutely, absolutely. Especially when it comes to dealing with obesity and diabetes, that sadly what often comes as a side effect of being obese. A lot of people deal with it. Oh, you eat too much. Oh, you need to just exercise. When in reality, there's so much mental aspects that go into people overeating and overdivulging, and to just handle that emotional aspect of it again is just so vital and key to your patients as a whole.
Yeah, we were talking about COVID earlier. COVID really put all of us through the ringer. Like, we all went through it. We all have some level of trauma related to COVID. And I think for me, it's saying COVID happened and we were all infected. You know, how can we work through that? What was it like to be really lonely and to be overeating? And how can we prevent that in the future? I send my patients home with a list of coping skills, great websites that can be really helpful to them, and to know that they're not alone and that there is someone there who's there to support them and work through all of their issues.
Again, truly, truly amazing. And Dr. Selzer, can you tell me a little bit more about this obesity epidemic within our country and some of the key things that you're noticing, some trends maybe?
I would say that the obesity epidemic is obviously increasing. More and more people are battling obesity. But with that noted, I think it's becoming more of an acceptable disease process that people are willing to talk about and deal with, as opposed to the quote fat shaming that has gone on previously. People are now realizing it's a disease into and onto itself. And this is something that, as a medical community and overall at large, if we deal with this head on, as opposed to in a mocking way, we can accomplish much more, and we can help people much more, as opposed to just saying, oh, look at them. How could they not control themselves? They must be, you know, a terrible person. They must not have any self-control, as opposed to looking at it as we can help people. And I think it all ties into also from an emotional and mental perspective. Meaning previously people would look at mental health in sort of a negative light. Oh my gosh, they have depression. Oh my gosh, they have bipolar. So as we as a community are learning to accept more people for their weaknesses, we will be able to help more and more people achieve greater success in all aspects of their lives.
Again, just truly remarkable how you're able to encompass all areas. Because I know, coming from a patient point of view, I never walk into internal medicine clinic or my family physician and I'm able to receive all different aspects of my health and well-being when walking into any type of clinic.
I think one of the more positive things of COVID was we started allowing patients to do and be seen over video. And I think that allowed more people who were afraid to go to the doctor because they'd be weighed. Now all of a sudden they have that barrier and they can just sort of get treatment. It allowed them that moment where they can sort of get to know everybody first without going, oh, your weight is X, just lose weight. Why can't you just do stuff? Now we're giving more and more medications and coaching people and helping people achieve success without having to have that moment of despair and that moment of fear that patients would go through. You could sense people's blood pressure go up when they first walk into the doctor's office, and then when they're even rechecked, you could automatically see how the blood pressure will go down.
Absolutely.
So the more you make people feel more comfortable and more comfortable with who they are and giving them an acceptable environment, accepting environment, the better off they will be.
And I love the word that you use, coaching, because coaching is not just about giving all the answers. It's about working with people and guiding them towards the path in which they need to take. You can't, make them make the decisions, but you can lead them, you can guide them. Again, really remarkable. And at your practice, how are you able to utilize IPV therapy with your patients?
So as more and more people are masking less, there's becoming more and more respiratory viruses that are becoming more prominent. So today, you're going to see a typical physician, a third of their patients are coming in with a cough. And especially as people age, where they're getting more and more lumbar lordosis, i.e. their back is not straight, they're more crooked. They have more and more difficulty getting mucus, that is the early development of bronchitis and then a pneumonia, out of their pulmonary lungs and out of their pulmonary space.
Oh, wow.
So with IPV therapy, we sort of give them that extra help in order with albuterol in order to get the mucus out of their lungs and out of them. And this way they don't develop full onset pneumonias and then end up in the hospital for days on end. I tell patients, we can give you antibiotics, we can give you steroids, we can give you all the medications in the world. Until we're able to get the mucus out of your body, we're never going to achieve success with his remission of the disease process that you're having. So with IPV therapy, when we go into the lungs directly and sort of really move that mucus out of them mechanically, it really helps them do significantly better. So that's why I like using IPV therapy to help my patients.
Absolutely. When Mr. Salazar was on the show, I was just like, oh my goodness, this is amazing. Not to mention you can do it in the safety of your home.
Yes.
So, Ms. Meckler, I have a question for you as a nutritionist. So, with the foods that we eat, I know all different types of crazy things are in our food, and you know some of it definitely does more harm than good when we eat it, a lot of those empty calories. So as a nutritionist, what are some trends of different foods that you're constantly seeing put in like all different types of foods that are kind of assisting with some of this, I guess, extra weight that people are putting on?
I would say the biggest thing would be added sugars. People don't notice how much added sugars they're consuming in a day until I show them how to read a nutrition facts label, and they're just astonished. Like, oh my goodness, I've been eating 25 grams of added sugars just from one product a day.
Yeah.
And so you had mentioned something earlier about, making changes, and what some people will come to me and they'll say, well, I eat a pretty healthy diet. And then I say, well, describe a typical day of eating for me. And after talking to them for 5 minutes, I'm like thinking in my head, really not. Like, we could make a lot of good changes. Let me show you how to read a nutrition facts label. Let me show you a different product to use. And I think, utilizing the computer, the internet is super important in my practice, because I'm able to go online to grocery stores and show them, instead of shopping for this, shop for that, and we'll bring down your inflammation that you're consuming.
Yeah, and it's those small little changes that really make such a big difference in people's lives, and they don't even realize that. Again, I'm gonna say it again: if you don't know, you can't do anything about that. So the fact, again, that you all three of you, well, four of you, I know you're missing one person right now, you guys are all able to work together to really help and guide people. So as the show is coming to a close now, do we have any last minute remarks you would like to tell our audience today?
I think I would say that everyone's struggle is real, and it's okay to ask for help. And by asking for help, it allows people to really understand what's going on in their life and identify what's working and not working.
Absolutely. And again, I'm so thankful to have each and every one of you on our show tonight. And again, their office is located in Delray Beach, Florida, as well as West Palm Beach, Florida. You're able to reach them at 561-365-3000. And again, I'm your host, Raymond Phillips, and thank you for tuning in to yet another episode of You and Your Doctor, sponsored by All County Healthcare. And we will see you next week. Stay tuned.